All right. I've got a red recording button in the top left. Does it say that I'm recording on your screen too? Can you tell?
I don't see that on mine. Let me make this bigger.
Okay. And I don't know. This is my first time recording a Zoom, so I might
Yeah,
not see it. Okay.
I don't see it on mine, but I'll take your word for it.
Okay. Dawn Anderson is is guest number 3 here. So Dawn is the director of imaging at Fairview, Northland, and I don't want to say too much more about your career, Dawn. So if you could just take a couple of seconds and describe your professional experiences, where you've been, where you're at, and then tell us about your educational background as well as a good place to start.
So thank you for having me on. My name is Dawn Anderson, and as Eric said, I'm the director of the imaging department, but I've also been the director of the emergency department. My background is nursing, so it's quite unique, a little bit unique that I'm running a radiology department as a nurse. But there is a lot of nursing opportunities in imaging also, so that background has been helpful for me. I started out as a 2-year registered nurse and then worked as a medical assistant. That's where my first healthcare job was. Worked in a clinic setting as a medical assistant for 7 years as I was going to school to get my RN degree. So I did it a little differently right from high school. I took vocational training, worked in the career in the industry for a while, realized my passion was really nursing. And then it was a little tougher course because I had to work full time while going to school. I had my first child while going to school. So a little different track than many of you guys will be of, going right onto the path that you want right from high school. For me, that was an advantage because it really helped me to see what I wanted to do. Being the mother of 2 grown college graduated children, I know the challenges of not always knowing what you want to do when you're graduating from high school. And I think for me, that was an advantage to start my career, my college career a little later when I really knew what I wanted to do. So most of my experience is in nursing, from frontline nursing, working in all areas, pediatrics, ER, ICU, to an education. My first leadership position was as an educator in the emergency department at Mercy Hospital, where I worked 20 years of my career before coming here to Northland. And then from there, I was a project coordinator for the electronic documentation system. So just showing some versatility of what you can do with a nursing degree beyond just nursing, teaching. I helped the IT people really see, what a nurses need, what a healthcare workers need, because an IT background might not know the workflows of a nurse. So I partnered with them to help them to understand how you create a documentation system to support the needs in healthcare. So I did that for a few years before I came here and took a supervisor position in the emergency department, and then which led me to the director, which led me to this position here. So I was kind of lost. I enjoyed the challenge of the electronic documentation system, but it was getting me farther away from my nursing roots and getting back to partnering more intently with patients and staff working in those areas. So,
yeah. Can you share where you did your education? So your 2-year nursing degree, and then, where did you,
yep.
How did you finish your degree?
So I got my 2-year nursing degree at Anoka Ramsey, and then I got my 4-year bachelor's degree at Metro State University. And when I applied for my director's position, I did not need my master's degree. Now that is changing. So people who are looking at advancing farther on, be aware that, or to know that if there's anything you want to do in leadership, pretty much nowadays you need a master's degree. I was lucky enough to be grandfathered in, and at the timing of my career and my age now, that's a lucky thing for me to do, because I know one of the things you ask is, what will you be doing in 5 to 10 years? And hopefully for me, it'll be retiring, because I've had a wonderful job in healthcare. So
Yeah, well, that's great. Can I ask how long you've been in this director position, or in a director position?
let's see, let me try to think. When I came here in 2008, so it's probably 2010 is probably
Okay.
when I moved. So about 10 years.
Okay. I know you've got a presentation for us, but before I start sharing my screen and get into your presentation, I completely neglected my chat pack question. So I'm going to rewind a little bit here. These chat pack questions are kind of fun, and they're not really related to healthcare at all. So
Okay.
this one right out of the box says, what is one trip you've never taken but would really like to take someday?
A trip. Oh, so my son and his girlfriend went backpacking in Thailand for 2 months. They're fishery biologists, and they were working contracted jobs where they would work really hard for so many months and then take time off. And when I saw the videos there, it looked fantastic. So sometime before, on my bucket list is to go to Thailand. I think that would be really fun. My family scuba dives, and the pictures that he has scuba diving there are amazing. So, and jungle, riding on the elephants, looks like a lot of fun. So that would be it.
That would be quite the adventure. Okay, we'll finish with another question kind of like that, but right now, I've got your mHealth Fairview presentation pulled up on my screen, so I believe, I think I could press share screen and Google Chrome, share. Can you see my screen?
I can see your screen. Yep.
Okay, so hopefully I think all that'll get recorded here. So I'm just gonna scroll through this as you talk, and if you want me to advance a little bit more or faster, you can just tell me
Yeah.
how to go here.
So this is just a little background, and maybe you've already gotten this from other speakers, but it's really just telling a little bit about who we are. So about a year and a half ago, we merged together, became one organization of mHealth Fairview. Prior to that, we were Fairview, and that just provided more opportunities for some academic and research and education of partnering with the University of Minnesota. So for most of you, I think all of you, if you're Princeton students, know where we are. There's just a picture of our organization, of our hospital. And, when you think of healthcare, I think automatically you think of some of the main healthcare roles, right? But there is a lot of other things depending on what you want to do. Some people may not want to go to a four-year college. Some may want to go to a technical school or through certification programs. So here's just a few more entry-level roles, or even roles you can do as you're going to school. So there's residential assistance in senior care, and that's kind of more geared to our Ebenezer, which is one of our facilities in the cities. But we also have nursing assistants here who really, help do patient care. They're nursing assistants. And then nursing station technicians, which is really kind of those front desk staff, registration, greeting people, getting them ready for their exams, and it's more of clerical work if you like that.
Can I pause for a second? So
yeah.
These are all jobs you could do as a high school student, correct?
Correct. Most of them you would need, like the nursing assistant is a small little certification.
Yep.
That you can do. Many do that as they're, and work in that field as they're preparing for nursing school.
And I'll give a little plug for Princeton High School here, because we have started a certified nursing assistant program. You can take that class through Princeton High School. We're partnered with Malacca High School just to the north, but kids could get high school credit for that and get their training to to do the nursing assistant job.
Yep.
How about the other two? So resident assistant and nursing station technician. Do those
So,
require training, or could you do those without a training program?
No, those would be, so the assistant is kind of more similar to the CNA. And again, we don't have a lot of, our residential is more in the cities, but the nursing station attendant. So a great example of that, whether you're going into health, you know, what part of healthcare you're going into. I have casual staff who just completed her nursing degree, but she worked casual for us just as needed in this more nursing station technician. So she did a lot of a little bit of patient care, but mainly was our front desk greeter who got all the paperwork ready for imaging exams, got the person arrived and registered in Epic. So it gets you into healthcare to really help you to see, you know, what do I want to do?
Right.
And that definitely is.
If you're truly interested in a career in healthcare, these are great entry-level positions to get some experience. I always advocate for kids to get some experience now if they're really interested, because not only does it help them figure out what they might want to do, or if they really are interested in healthcare, but once you're looking for that first job, having some experience is a big factor in setting people apart. So I'm glad you have those on there as potential high school positions. They're great.
Yeah. And I think it kind of goes with that being well-rounded in high school. I was also on the scholarship committee this year. So that is one thing that we do look at, you know, when people are applying for scholarships. You know, everybody always thinks it's just your GPA, but it's not necessarily that. It's, you know, what kind of community work do you do, giving back to the community? How involved are you in your school? You know, what organizations and things are you involved with and do? Are you doing anything related to the career you want to go into? So it makes a difference, not only for the experience, but there are a lot of opportunities for scholarships out there that people just aren't even aware of, from
absolutely.
high school and when you're in college even. So this just gives you some ideas of salaries. That's always an important thing people want to know, you know, is there a need for these jobs and what kind of money will I be making? So this is a little bit helpful to just start of looking at those entry level, and then an LPN, an RN, or an X-ray tech. Those are my specialty and background areas. So a little insight into that. And then this just lists a few more of other pathways beyond what we talked about. And a lot of these can be entry-level jobs with just a high school degree too. You know, a transport aide, housekeeping, lab assistant, radiology assistant, supply chain, nutrition aide, you know, patient coordinator. A lot of people forget about those things. Keeping and working in our cafeteria. So a wide variety of things that you can do within the hospital setting.
Okay. Yeah, I really appreciate this slide right here because I've talked to a lot of people because of this class, and I'm always really curious to see the path and hear the path that people take. As far as my profession goes, teaching, you know, a lot of times people will get a teaching job and they'll do kind of the same thing for 40 years, really. But that's not necessarily the case in healthcare. I've talked to a lot of people who started out with a 2-year or a 4-year nursing degree, and then they've progressed into an administration position, or, you know, a director position, or just something that is really different because your nursing degree doesn't necessarily come with a job title. You yourself, Dawn, have a nursing degree, but you're doing something that's a little bit different now. So I appreciate hearing the different perspectives and different pathways that people take.
Yeah, and I think, you know, as I stated, I was that person who started in that. You know, I took a more entry level of healthcare. It was a 9-month vocational training, but it helped me to decide, you know, what do I really want to do? Because in that job, I did lab nursing, X-ray, I did a little bit of office management skills, and then it helped me to decide where am I really passionate, and the nursing portion was where I was really passionate.
Yeah, I'm just going to connect back quick to the first person I talked to. His name's Tanner Neubauer, and he's a healthcare administrator now, but he talked about his advice to kids was take your first job. You know, it's not going to be the job that you necessarily want, but his example was, you know, he was wiping down hospital beds and turning over rooms, and that it opened a door for him. It provided a first opportunity for him, and his dream job wasn't being a healthcare administrator, but he really enjoys what he's doing now because he took a first job, he got some experience, he figured out what he wanted to do. So I just thought that was some really good career advice, was to, you know, take an opportunity even though you might not know anything about it, and just be open to something different right away. So take your first job, even if it's not what you necessarily think it's going to be.
Yep, that's great advice. And then again, just some other non-patient care. So say you're passionate about healthcare, but you might not want to do direct patient care. So just some other things that are listed here: admitting clerks, finance, medical records, coding, health information clerks, information technology, accounting, staffing department, interpreters, you know, a lot of different things that maybe most people might not even think about. And then these are the ones that kind of more people think about when you think of healthcare: physicians, registered nurses, which is what I am, a licensed practical nurse, certified nursing assistants, nursing station attendants, or more in clinics, the certified medical assistant, clinical nurse specialists, infection prevention, health unit coordinators, just kind of as the list goes. Those are kind of more things that people think of when you think of patient care. And then a lot of popular jobs that people go into is rehab, especially, you know, physical therapy, occupational therapy, speech therapy, cardiac rehab. So those are all umbrellaed under the cardiac rehab. Nutrition services, from entry level with cooks and dietary aides up until dietitians with, you know, college degrees, and then pharmacists, of course, and pharmacy techs, which is also a nice transition to start into if you're thinking of pharmacy. And then surgical services, again, a lot in there, from nursing to nurse anesthetists to surge techs, anesthesiologists. So there's a lot of variety of things with different educational components and levels with that. And then the imaging department, which is currently where I am the director over, lots of different modalities in X-ray, from general X-rays to mammography, CT, MRI, ultrasound, nuke med, lots of different things that you can specialize in X-ray too.
Just to interject here, there's a significant, I appreciate this presentation a lot, but I'm just trying to think about this from a high school kid's point of view. If I'm a high school kid and I think I'm interested in healthcare, but I'm a little overwhelmed at all these different options, can you give some advice for a kid that's trying to figure out where they might fit in healthcare? How might they figure out if they want to work in surgical services or clinical diagnostics, or if they want to do some rehab stuff? What would be a good way to have some discovery on the type of healthcare or the area you would be a good fit?
Yeah, I think, you know, talking to people who, you know, many people, you know, I hear a lot of stories that I went into healthcare, I went into nursing because my mom was a nurse, my grandma was a nurse, I understood nursing. So it's always nice if you have someone to be able to talk to. You know, nowadays with technology that I didn't have when I was in high school, is you can just search anything to learn whatever you want to. Prior to COVID, and to be honest with you, I'm not sure where we're sitting at for this right now, but we always have been open to job shadowing. We've been very supportive of people. I've seen it here in this department, and when I was in the emergency department, we had a lot of people job shadowing, because actually, you know, being there, working side by someone, you really get to see, you know, the work that they do.
Yeah,
So
Diana mentioned that yesterday when we talked, and she said she has somebody signed up to volunteer, but it's been pushed way out, and they're trying to figure out a way to make it work, during the pandemic now. So she advocated for that as well, and she kind of gave the same advice, kind of get into the trenches and see what you like and what you don't like. So I think that's really good advice.
yeah. And then support services, there's a lot, social workers, chaplain, grief counselors, if counseling is a passion of yours, patient relations who works with people who have concerns or regarded, anything that happened during their experience here. Information desk, technology. If you like technology, informatics is a very popular trend that people are going into, nursing informatics, similar to the role that I said I did, through my transition to where I am now, of really working on the medical health records and, how you take that IT piece and work with your healthcare background. So that just lists, I won't go through all of them, but the slides pretty much list things, and then things that you don't think of, like facilities, environmental services, housekeeping, facility engineers who keep our hospital running and, doing day-to-day things, IT person, people, biomed, who keeps all of our equipment running. If you're more that techie person who likes the idea of working in healthcare, but it's really more a hands-on person, there's those options too. So those are listed all on this next slide. So really that was just to give you a little bit of ideas of salaries, opportunities in healthcare, and many more, but that just touched on kind of the higher level ones.
Yeah, I think that was really good. I'm glad you showed off all those opportunities at Fairview, and we've done a little bit of career investigating with some specific healthcare things, and so that was good to see that Fairview offers a lot of the things that kids were interested in. So if we can move on to my list of questions here. I don't know if you have them in front of you,
Yeah.
but I'll try not make this feel like a job interview. But the first one that I want to jump into is number 3 on our list, and I'll give you a little bit of background on that question because it started, I think, 3 or 4 years ago. Princeton High School partnered with a handful of community organizations, Fairview being one of them. Crystal Cabinets was also on the list, and the distillery was on the list, and there were a handful of businesses that we asked to come up with critical skills. So like if they were hiring a new employee, what are some of the things that these places are looking for? In the top 5, once we unpacked it and narrowed it down, that came from all of those organizations were communication and collaboration, teamwork, self-management, critical thinking, and accountability. So I'm not necessarily asking you to memorize those things, but if you could kind of just talk generally about how often you use those skills, what does it look like, feel like, sound like as an actual employee of Fairview when you need to do some of those things like communicate and work as a team and self-manage and critical thinking skills.
Okay. Yep. I just jotted some things down on that. Communication and collaboration, extremely important in healthcare. Data will show that 80% of medical errors occur when there's a lack of communication. So we work, we put a lot of focus on safety always, having those crucial conversations, having each other's back, of stepping in, even giving permission to say, if I'm a frontline staff and a doctor who I feel is a little bit higher than me, to say, wait a minute, stop them if they see that there could be potentially an error. We don't allow something because you don't feel comfortable to share. So communication is extremely important in healthcare. And collaboration too. I always say that there is no role in my departments that is more important than another. From the cleaner to the radiologist. Everybody's job is just as important. And I say, you know, if a housekeeper says, well, I don't do what you do, I'm not as important. Well, yes, you are. You are our infectious control person who is making sure that everything is clean so that it decreases infections happening. Your job is extremely important. Don't ever underestimate that. So we collaborate with other departments amongst each other. It's always a team approach to addressing patient care. The next one, let's see, that goes right with teamwork. I mean, that's a common question that we ask in every interview. You know, tell me what teamwork means to you, because teamwork is so important in healthcare. And again, it's that collaboration of multiple people, multiple departments to care for that patient. Self-management, that is something that we look at too. You know, in healthcare, you don't always have someone that's there telling you what to do. You need to use your critical thinking skills. You need to work at the highest level of your education to be the most effective you can for the patient. And I think I see that even more so in a small community hospital. So I've had staff who come from large hospitals who, when they come to a small hospital, they're like, ooh, you know, I've got to retrain myself, because I always had residents who did this for me, or I didn't have to transport anybody. I had a transport team, or I had respiratory therapy here, and we don't have respiratory therapy 24 hours a day. So I'm gonna need to re-educate on airway management and giving neb treatments and different things. So in a community hospital, people do work at the top of their degree, because we don't always have the resources that bigger hospitals have. And that's why many people like working in a smaller rural hospital, because you use all of your training and you get to do a variety of things that in larger places you don't get a chance to do, because there's a lot more roles that are jumping in and doing that.
Yeah, can we pause for a second, and could I ask you to expand on some of those some of that comparing and contrasting between a small community hospital like Fairview Northland and you know, a larger hospital in a more metro area? Could you talk about the pros and cons of those different environments?
Yeah, I think that, you know, being a smaller hospital, there are things that we aren't able to do that a big hospital does. So I think of strokes. We're an acute stroke ready hospital. So we're set up to be ready when that person comes in with a stroke, to be that, to do all the initial interventions that need to be done for the best outcome for that patient. But then we don't have neurologists we have neurologists in our specialty care, but we don't have neurologists on site. So the next level of care for that patient would be to be followed up by a neurologist. Same with the cardiologist. So we're going to do those life-threatening things right away to stabilize them. Then we're going to get them to a larger hospital that has those services that we might not have. We have all the initial services that we need, you know, CT, to do a CT scan if you're looking at a stroke, to see, you know, where the bleed or where the stroke is. Once that's identified, you're pulling in a neuro radiologist and a neurologist right away, working with the ED doc, and then making that plan of care for the patient. And usually that plan of care will be get them as quickly as possible to that next level of care where you have the services here, you know, there to, is that kind of where you were going with that?
Yeah. You know, it's good to know the difference in services, but like if, you know, if me personally, I know myself well enough to know I would appreciate a smaller environment. If I were working in healthcare, I'd probably want to be at a place like Fairview Northland. But if somebody wanted a bigger hospital environment and they, you know, have a nursing degree, they're interested in healthcare, what would push them towards a larger hospital maybe? Like what would be the advantages of working in that?
I think that if you really wanted to specialize, so for instance, I was a nurse, and I'm really passionate about cardiac care. I know that there are some things we keep here cardiac related, but if I want a place that I want to be involved with caring for a patient who's had open heart surgery, or I want to work in a cath lab who I'm going to be that interventional cardiac nurse who's in the procedures, opening up those, putting in a cardiac stent and working on them. I want to be in that hospital. I'm really interested in trauma. I want to be at a level 1 trauma center. You know, we're gonna see trauma here. We are trauma certified as a level 3 trauma center, but say HCMC or North Memorial is a level 1 trauma. So if I'm really passionate that I want to be involved with trauma care, I want to be involved with amputations and reattachments and that piece of it, I'm going to want to work at a bigger hospital that has those services. But if I want to say, you know, I want to be the jack of all trades and I want to be able to do a little bit of everything, a rural hospital is that better fit for you.
Okay. Yeah, I think that's really good. I'm kind of taking our conversation in a different direction here. I hope that's okay with you.
That's
I know
okay.
you're looking at our questions, but that just made me think about your background that you've shared, and it sounds like you have done a lot of frontline nursing in your career, and I'm just wondering if you could maybe compare and contrast your experience as a frontline nurse, you know, kind of in the trenches doing all those things, to now as a director position where you aren't necessarily doing some of those frontline nursing things.
Yeah. I think back one year when it was Nurses Week, and my son, who was, I probably was like 16 at the time, and he said, yeah, like when you used to be a nurse, Mom. And I'm like, well, I'm still a nurse. It's different. So people will always ask me, that's a common question. Do you miss being a nurse? Well, I am a nurse. I'm using my nursing degree in a different way. So when I think of what I did as a frontline nurse, in all the different areas that I worked in nursing, it was patient care related. So I was, you know, personally connected more with my peers, working as a team with my peers, working with the patients, working with the providers, the physicians, the specialists on the care that we needed to do for that patient. I worked normal hospital hours, whether as a nurse, you usually are doing shift works, that you're working days, evenings, nights, a combination of them, you're working weekends. For me, that was probably the best thing in a career as my life changed. So when I was young and didn't have children, I knew the hours that I wanted to work. When I had children, I could work an evening shift so that I could be home with them during the day. My husband could be home with them in the evening. A lot of people then, when their kids go to school, they go to a night shift because they come home from work, their kids wake up, their spouse is leaving, they get their kids on the bus, they go to sleep, they wake up when the kids get home, they're there for all their activities and sports, and they can be an involved parent. So that is one thing nice about hospital nursing and many hospital jobs, is that if it's patient care related, you can work multiple shifts and you have opportunities to fit that into your life more. You also have opportunities to say, I want to work this many hours, or I want to cut back and work this many. And healthcare is one that you could work part-time and still get healthcare benefits. Many organizations might say, or many jobs might say, well, your job is full-time. You know, if you want to stay home part-time with your children, we don't have that option for you. So it's full-time or it's nothing. Healthcare is very flexible with that, and that's what I like about healthcare.
Is there anything that you miss about being a frontline nurse?
I do miss the patient interaction because I'm a very people person. On the flip side of that, when people will say, you know, why are you working in leadership? I remind them of the importance of, you know, my job is to make sure that the staff that are caring for you are competent and trained to do what they need to do, that we have policies and procedures that follow best practice and evidence-based research, that's going to be the best outcome for you. Then I'm managing the finances. So this department is open so that when you come in, and to make sure that we have the proper equipment and things that we need for not only my staff, but the patients. So I'm still focused on patients, patient safety, the best thing for the patients in a roundabout way. But now I also have employees that I need to make sure that they're competent, they're enjoying, they're having engagement and joy in their work, and opportunities of how I can help do all of those. So it's still extremely rewarding, and I still have patient contact. I'm a very frontline leader, so where I can't be out doing the work, more in the ED department, I could jump out and do stuff using my nursing degree. Here I help in other ways. I'll help the front desk so that they can go on break, or I'll go transport patients. I don't have the skill level to do their job as a technician, but there's lots of other things I can still be involved with in patient care. And I get the opportunity to talk to patients, rounding on patients. When patients are sitting here, how's it going? Taking a minute and just talking to a patient, finding out how their experience is, and sharing that with the team.
Yeah. So one of the questions I always really like asking is about vocation. So if you're following along here, this is kind of question number 4. But when I talk to high school kids about that, a lot of times they haven't heard the term vocation before, and they think I'm talking about a vacation, but it's different. Vocation is the sense of passion and the feeling of being called to a profession. And I think nurses specifically have a strong sense of vocation. And you've kind of talked about the rewarding feeling that you get from your career. So if you could just talk a little bit about, the vocation, the sense of vocation that you have, and feeling called to healthcare in general, and specifically nursing.
Yeah. I think my vocation story is going to be a little boring compared to what you hear from others. I have many people that, as I've been involved with these type of programs, I hear people saying, I knew I wanted to be a nurse since I was 5 years old, and my parents would tell me stories of doing this. Or, some people just have that I know at a very early age what I want to do. I didn't have that. My vocation, really, I was very, in high school, I was very involved in high school. I was a 3-sport letter winner. I was in National Honor Society. I was in student council. I was very well-rounded, but I love sports. I was very athletic, and I was going to be a FIA teacher. That was my vocation up until a high school teacher, a FIA teacher, because I was a gymnast, asked in middle school for me to help with teaching some classes or doing some classes. And I kind of went, wow, maybe I don't want to do this. So again, it's back to that question. Sometimes, you don't know anything until you actually have that experience of working with someone. And so I really didn't have that passion, but I do know that the things that you take in school that tells you what you would be good at kind of geared me toward healthcare. And I think it's because I've always been a very natural leader. I'm very passionate about, working with people and helping people. And so it just kind of got me thinking about healthcare. And at the time when I started thinking about what I wanted to do, was the time that there was, like now, there's a shortage of nurses. And it was really hard to get into nursing school. And even though I was a good student, I was afraid that I might not succeed. And because that's when I went on interviews or when I looked into nursing, it was really hard to get in a program. And that's why I kind of did the path. I'm like, well, let's start with the medical assistant and see how that goes. And then indirectly led me back into nursing. But I didn't know until, I was probably a senior that this is kind of the track that I want to take.
Yeah. Well, first of all, it made me smile that you said you thought you wanted to be a health and phy ed teacher for a little while, because that's what I do. But I don't think anybody's vocation story is boring. I really do appreciate hearing about people's vocational journey, and I appreciate yours. And I think it's great. And I think that's one of the most important things that I ask health professionals to share with these kids, because that's the most important thing, really, is finding a calling and finding a passion for a profession, whether you're working in healthcare or something else. So I think if kids can take something away from this course,
Yeah.
I hope it's that.
Yeah. And I think, for me, a not happy story is my father passed away when I was a senior in high school. So as I was doing my career plans, I was the youngest in my family. And one of the things also that held me back from going away to school was feeling the commitment of needing to kind of be home with my mother and help her through this. So that kind of delayed also a little bit of my long-term goal, but something that I never have regretted.
Yeah, so I think that's a pretty good transition into another question on my list here regarding change. So, I'll give you a little bit of background on something we did right away. We watched, there's an old story, it's a metaphor, it's a parable called Who Moved My Cheese? So
Oh,
some
yeah.
people are familiar with it, some people
Yeah.
aren't, but it's really a parable about change and how important it is to be willing to adapt and adjust and make the best out of situations. And I thought it was a really good lesson to start with, especially considering our learning conditions right now, and finding the best in our current situation. And it sounds like you made the best out of a situation coming out of high school. And so I'm just curious about some specific instances or events that have changed that you have experienced and adapted to, and so things that are different or ways you were resilient in your career.
And I think that, of course, everybody can say COVID right now, right? I mean, that's a huge change, but there are always changes in healthcare. And I think that, if you are in healthcare, you really have to be open to change. And because things are changing all the time, technology changes. You can't have the mindset of this is how we've always done it, and I'm going to ground my feet, because if research and evidence-based research is showing that this change has a better outcome for the patient, it may impact how I do my work. There's a lot of regulatory changes. So healthcare is highly regulated, that changes are made because of that. Or the last few years, there's been a lot of changes in healthcare reimbursement that health companies are making decisions that used to be decisions that physicians could make. So, for example, I have an elderly woman who really doesn't need to be admitted to the hospital, but she really doesn't have family to be able to help her. So we would admit her to the hospital to kind of get her through that, and then be able to discharge her home. Well, in today's situation, insurance companies are basing what they will pay and what they won't pay. So if you don't meet a certain criteria to be admitted, you're sent home. So we provide the resources that we can to help that person, but it's really hard for healthcare workers, because we know that maybe this woman might not have what she needs to send home, or we can't get those services till the next day, but she doesn't meet criteria for an admission. And unfortunately, we're a business too, right? So we can't admit everybody for free. Fairview does a lot of, writing things off and helping people in financial need, but we have to follow those rules, which sometimes are really hard for us to do, and to have to explain that to a patient. So that's just an example of how things are changing. Some things medically for the advantage of the outcome of the patient, and we have to, redo our work. Technology, I mean, there are nurses my age, healthcare workers my age, and even older, who really struggle with, when we went to electronic documentation. I mean, we grew up without computers, if if the kids can imagine that. I mean, so technology and advancements in technology can be really challenging, but that's part of our work. So, I remember, 12, 15 years ago when we really started getting into electronic documentation systems, people were like, there's no way I can't do this. This is, we can't, fought it. And now people are like, I can't imagine going back to documenting on paper. So, I mean, that's a big change there, just technology. We have robotic equipment doing surgeries where that can get fine, delicate things that a surgeon's hand can't get into. So a surgeon is using a robotic instrument to do your surgery. Surgeries that you had incisions this long now are laparoscopic, tiny little pokes that laparoscopic machines can do. So changes are happening all the time, and you have to be open to change because it's just part of healthcare.
Yeah, I think that's really good perspective. Even what we're doing right now, I mean, who would have thought even a year ago we would have been able to have a conversation like this with over Zoom or Google Hangout, or I didn't even know Zoom was a thing until about 6 months ago. I'm going to keep moving here. I'm on question number 7, if you're following along.
Yep.
Can you tell us about somebody who has mentored you or someone you've learned a lot from, either professionally or personally?
Yeah, so when you asked when I read that question, the first person that came to my mind is Kathy Wild and Kathy Shield. And they are, when I entered into my leadership role, which when I went to school for nursing, you have a little bit of, leadership classes, but that was a big learning for me. So these two women were extremely, they were such good leaders, and I would sit back and just watch how they would handle things. So how do they handle a really tough situation? What I saw was they really sat back and they really listened to understand and to see that big picture, and not jump in and try to say, no, you can't do this, or problem solve, but let me really understand, why you're so passionate about this, or why you feel this. And for them, they were the first two people that came to my mind. And I think from a frontline perspective as a nurse, you always have mentors. You work with people who you get to know who's really passionate about things. Like I know that Carla is really strong on cardiac rhythms. So if I have a question on cardiac rhythm, I'm going to go to Carla and I'm going to say, let's look at this rhythm together, because I know, you really are passionate about cardiac rhythms. So you get to learn kind of also your mentors and who are those go-to people that you work with every day. That is truly kind of your mentors and your specialists on certain things, because there's just so much that you need to know in nursing.
Yeah, I think you bring up a really important point. And I think about myself as a young professional. I thought I needed to know everything, but that's such an unrealistic expectation. Eventually, I just figured out I need to know people who know things more than I do. If I know who I can talk to get an answer to this question. And it's okay if I don't know it, because I know some people who do know about it.
Yeah. I say that to people when I meet with them when they are just completing their orientation, and saying that I expect you to ask questions, and I never want you to be put in a situation that you feel you have to do something and are pressured to do something. I'm giving you the power, and I'm giving you the permission to say, you know what, I haven't been trained on that, or I don't feel comfortable on that, but hold on, let me find someone who is. And I think a good lesson out of that too is, I remember I started my nursing career in pediatrics, and my next jump was the intensive care unit, where we were a pretty big intensive care unit. We did craniotomies, brain surgeries, open heart surgeries. We did a lot of big things. So working from a peds nurse to this was a pretty big transition. And when I was in my interview with the nurse manager, she asked me a question about my comfort level, or what she thinks. I don't remember the exact question. What I do remember is I honestly told her that this will be a big learning curve, and I think that I will do a really good job, but I'm not going to be that expert that's coming in and knowing what I can do, and that this is a big jump, and I'm really excited for it, but I know that there'll be a lot of learning. And the one thing she told me after she hired me is, she said, if you would have came in and said, I've got this, I can do this, I would have been worried about hiring you. But you saw that going from a pediatric nurse to an ICU nurse was going to be a big learning, and that you were up for the challenge, and you realized that it wasn't going to be easy, but you were committed to doing it. That's why I hired you. So I think an important lesson in that is, be honest during interviews. But sometimes people think, just selling themselves is what you need to do, which is true, but you have to be honest too, right?
Yeah,
So.
I think that's a really good example of a growth mindset. So we talk about that all the time in high school, and how important that is for a high school kid to start developing that. But what you described is a tremendous example of having a growth mindset, because you said, I might not be able to do this yet, but I know I know myself as a learner. I know how to ask questions. I know who I can go to, or how I can develop the skills for this job. So I think that's a really good example of a growth mindset. Question number 8 on our list. This doesn't have nearly as much depth, but I still think it's worth answering. What is your dream job besides your current position? Or if you thought about yourself as a middle schooler, what was your dream job?
Boy, probably a middle schooler would be some, really elaborate, exciting job. But I don't know. I know that's a question people ask a lot, but I mean, I'm very fortunate that I really love what I do. So not everybody can say that. If we're really going to stretch a dream job, so I'm a tennis player. So living out in Hawaii, teaching tennis lessons, being a professional tennis pro, that sounds pretty exciting to me.
Yeah,
but
that'd be a good job.
If we're going to dream big, right?
Yeah, yeah. So just a couple more on the list here. In question number 9, to be honest, I'm not a real big fan of this question, just because I think things change so often. And sometimes when I answer the question about where I see myself in the future, I feel a little locked into that answer, even though there's, so many different circumstances that could happen. So I don't necessarily believe in absolutes, like this has to happen, or always this, or never that. But if you had to answer the question hypothetically, where you see yourself in the future, so 1 year, 5 years, 10 years, where do you see yourself?
Yeah, and I talked about this kind of early on. So a year, definitely still here in my role. 5 years, financially, as I worked with our financial advisor, that I will be ready to retire in 5 years early. I don't know. I mean, I love working, so I don't know if I will be retired in 5 years. Definitely in 10 years at my age. But 5 years, maybe if I want to kind of ease into retirement, there's lots of things that I can do with my background in healthcare. Being a director and ultimately responsible for all the employees in your department, the patients in your department, the finances of your department, it's a higher level stress job. So maybe I would say, you know what, I just want to do something part-time that I can use my nursing degree just to do something, but to kind of ease into retirement. Knowing myself, it would either be that, or I would continue to work and might not retire early, but my husband might have a say on that too. So
then you can take that tennis job out in Hawaii.
Yes.
Last question on the list before we finish with a chat pack question. But if you were going to give some advice to these high school kids, you could either think about advice you might have wanted as a high school student or needed as a high school student, or just general advice for the kids that are going to see this. What would you tell them about their educational career and some career advice?
Yeah. So as I answer this, I'm going to think as a healthcare leader and as a mom who has two children who graduated from college. So the first thing I would say is be very well-rounded in high school. Take advantage of opportunities that you have. My children received scholarships. My oldest child received a lot more scholarships because he was much more well-rounded than my second child. Both very good academic students, but my oldest was in band, he was in sports, he was in National Honor Society, he volunteered in the community, he volunteered at, he did things through church, and that helped him to get, not only to get into college, but to get a lot of scholarship opportunities that my other child didn't have, because they do look at that. And as I said before, that was one thing we looked at when we were choosing the scholarships that Fairview was given out. Some of them could have been some of you listening on the meeting today. But so that would be the one thing that I would say, be very well-rounded. Don't forget the importance of volunteering and doing community work. I mean, that's huge. I would also say if you're going to college or an extended amount of time, to seek out, even when you get to college, there is a lot of scholarship opportunities, which my oldest son, being the first one to experience, didn't really realize until he was in college a couple years. And then when he started applying, he was getting, thousands of dollars, I got another $1,500 scholarship. And in retrospect, it's like he was eligible for that as a freshman and we didn't know that. So, seek that out and go to your counselors, go to, the administration office and see what's available and take the time to fill out an application. It's well worth it. I will tell you, when I went back to school for my bachelor's degree, I was working at Mercy Hospital as a nurse. I had children by then, so I volunteered in my kids' school. I was working and going to college, and I didn't pay a dime for my bachelor degree with what I got from the help that the hospital gave me, and from scholarships that were out there even as an adult. I maybe paid a couple $100, but that's it. So there's a lot out there if you take the time to look.
Yeah, that's great advice. I really appreciate your advice about being well-rounded, because I always support that, and I was kind of like that as a high school student too. I was okay academically. I wasn't great, but I think what made me appealing in the college admissions process was being well-rounded in lots of organizations and sports, those types of things. Okay.
Yeah. I just a couple other ones that came to mind too. If you're not sure what you want to do, start out with taking generals first. I mean, this was probably my mom hat, because I had one that was very focused and stayed focused to that, and one who 2 years later totally changed. And all of the generals that he took, he started in criminal justice and law enforcement and then went into accounting, which are two totally different. So it delayed him having to do additional school of graduating on time. So, if you're not sure what path you want to do, taking general electives, and a lot of times for nursing classes, you don't get accepted right away. So that's even more important for nursing. And then probably the one thing that I would say if somebody's going into nursing is to look right at a 4-year program, because if you want to do hospital nursing, might not impact if you want to work in a nursing home or a clinic, but a hospital setting, there are not many hospitals around, except if you're very, very rural, that will hire a new grad with a 2-year degree. They're really looking at 4-year degrees and really kind of weaning out the 2-year program. So that would be my advice if you're going into nursing. And my parent hat would also say, watch what you post on Facebook and social media, because employers do look at those sort of things. And, when you're young, you don't think about what you're posting and what you're putting on. But again, when somebody is looking at you for a potential hire, people have access to look at things that we don't always realize they're looking at, college applications, scholarships, other things. So just be very mindful and careful of what you're putting on social media.
Yeah, I appreciate that. Anytime somebody backs up us teachers, because we talk about that a lot, but sometimes it's just noise coming at those kids. So hearing it from a different perspective, I definitely appreciate that.
Well, and I know that personally, my kids might not listen to me, right? Because I'm their mom, but sometimes they'll listen to other people. So from a mom and a potential, from a leader who is hiring staff, very important.
Nice. Okay, well, one chat pack question to finish here. If you were given $100 gift certificate to spend at any store, where would you choose to redeem it?
Ooh, any store. Well, my kids would probably say Kohl's because they know I shop at Kohl's all the time. So they're probably right. I'd probably go to Kohl's.
Oh, all right. That's good. Well, Dawn, I really, really do appreciate you taking some time here. And I really do believe that this is what's best for kids. And I know they appreciate being able to watch this rather than just click through their online curriculum. So thanks for your time and your perspective and sharing some stories with us.
You are very welcome.
All right. I'm going to press stop recording here.